भएको फिमेल सेक्स हर्मोन्सहरु पढ्नु पर्छ कि पर्दैन फिजियोलोजीमा?
Yes, ma'am.
पढ्नु पर्छ है। अनि स्टार्ट गरिसक्यो फिजियोलोजीमा?
भइसक्यो, ma'am.
Okay. So today we'll be discussing on hormonal contraceptives, mainly related with the female hormonal contraceptives. Okay, so to understand the mechanism of these contraceptives, you must know the physiology part of the female sex hormones also. Okay, MBBS मा त female sex hormones related drugs हरु नै छ, तर तिमीहरुकोमा छैन, direct hormonal contraceptives मात्रै भएकोले I was asking. Anyway, okay, we'll start this. I think everyone knows by now what is contraceptives, right? So it's a contraceptives, okay, they are the method, okay, or devices they are used to prevent the pregnancy. Okay, so unwanted pregnancy, or newly married couple who doesn't want to get pregnant, okay, or already who has fulfilled their family and they do not want to take they don't want any more pregnancy, or the family where the person wants to gap between the two child, okay, in those conditions contraceptives are used. Okay, there are different methods of contraceptives. Okay, they are called mechanical contraceptives, or what you can say is there is a barrier methods or devices or they are used as a contraceptives, but this is a hormonal contraceptives, means it's related with the hormones. Okay, and female sex hormones भनेपछि त के छ female sex hormones? I think I should name the name of you, one of you, right? अनि मात्र भन्ने होला। मोनिका, के छ female sex hormones?
Ma'am, estrogen, progesterone.
Yes, okay, estrogen and progesterone. So female sex hormones, estrogen, progesterone हो। फेरि तिनीहरुले कसरी चाहिँ युज गर्छ त है कन्ट्रासेप्टिभ्समा? प्रेग्नेन्सी लाई पनि चाहिन्छ estrogen, progesterone, तर as a contraceptives पनि they are using hormonal contraceptives are used, isn't it? Isn't that interesting, eh? So we will come to know. Okay, so let's go with the definition first. Okay, so contraception भनेको चाहिँ के हो त? Contraception भनेको चाहिँ it means the interception in the birth process at any stage ranging from ovulation to ovum implantation. Okay, so they inhibit the process, okay, birth process from the beginning from the ovulation, okay, in the female, okay, beginning from the ovulation to ovum implantation. Okay, so contraceptives चाहिँ त्यो गर्नु भयो। So contraceptives भनेको चाहिँ it is a procedure or device that is intended to prevent the pregnancy. Okay, now there are different methods of contraception. Okay, mainly we can divide by two major groups. Okay, spacing or temporary methods, and terminal or permanent methods. Okay, temporary methods means we can use this contraception, okay, to increase the gap between two pregnancies, or it is an ideal contraceptive agents which should not only be safe but provide the reversible suppression of fertility. Whereas terminal methods भनेको चाहिँ it is a permanent sterilization is obtained. Okay, so this is a permanent. Okay, and temporary means there should be an it is used to increase the gap between the pregnancy. Okay, and this type of methods should be very safe so that there is a reversible of the suppression of the fertility also. Okay, so both this type of methods are available in both male and females. Okay, contraceptive methods both male and females ma pani available छ. So for females we can divide into spacing. In spacing methods there are different methods like rhythm method, okay, barrier method, chemical method, and intrauterine devices. Okay, so rhythm method ma चाहिँ usually calendar method पनि भन्छ हैन, according to the calendar method. Okay, during the ovulation period, हैन, if there is a gap then we can obtain the contraception. Okay, similarly barrier method ma चाहिँ there is a condom हैन अनि अरु के devices are use गरेर चाहिँ diaphragm, okay, then agents, okay, these devices are used to prevent the pregnancy. Okay, chemical methods ma usually drugs related method, okay, or hormonal methods or hormonal contraceptives also, they are the chemical. Intrauterine device say, I think you have heard the copper T, you know, these are the device that is used, okay, to prevent the pregnancy. And as for terminal method, okay, tubectomy, okay, or laparoscopic occlusion of tubes, okay, fallopian tubes, they are occluded or dissected, okay, to obtain the permanent method, that is the surgical procedure. Okay, similarly for males also there is a withdrawal method, barrier method, and chemical method. And then as for permanent method, okay, vasectomy and vas occlusion can be done. Okay, so here we will be discussing mainly related with the chemical method, that is the hormonal methods for the females. Okay, so as for classification of female hormonal contraceptives, we have got oral contraceptives, okay, in which we have got combination pills, mini pills, and postcoital pills. Okay, these all contains the hormones, either progesterone, estrogen, or both. Okay, combination of estrogen and progesterone. Okay, so this is the oral contraceptives, oral hormonal contraceptives. Okay, and next we have got other hormonal contraceptives which can be given by injection, okay, mainly intramuscular, in which we have got depot metroxyprogesterone acetate or DMP. Okay, and then we have got norethindrone, norethistérone enanthate, okay, which is the progestin preparation. Okay, this can be also given by injection, that is intramuscular. Okay, and then newer methods like levonorgestrel subcutaneous implant. Okay, this implant is inserted in the subcutaneous tissue and which acts for a longer period of time. Okay, that's a newer method. Then we have got intrauterine inserts, that is like a copper T, okay, that is kept in the uterus. Okay, and but it does not contain copper. Okay, in copper T usually copper is there, but here levonorgestrel, which is again a progestin. Okay, levonorgestrel is a progestin preparation, type of progestin preparation, okay, that is present in this device which is kept inside the uterus and will have a contraceptive action. Okay, so this is the newer methods. Okay, now as for male also there are hormonal contraceptives, okay, like testosterone eudiconate. These all are testosterone preparation. Okay, then testosterone eudiconate with depot metroxyprogesterone acetate. Then there are anti-androgens. Okay, and then other cytotoxic drugs like cadmium, nitrofuranz, and gosipol. Okay, these are the male hormonal contraceptives, but less commonly used in male as a hormonal contraceptive because it has been found, okay, that it takes several months to recover the fertility. Okay, and also sometimes it can lead to inhibit the spermatogenesis as a permanent. Okay, so this hormonal contraceptive is less commonly used in males, whereas gosipol, it is a newer non-steroidal compound, okay, which has been effective for the male contraceptives. So we'll discuss mainly for the female hormonal contraceptives. Okay, so as for combination pills, okay, the name combinations pills means it contains both estrogen and progesterone. Okay, which contains the low dose of estrogen and progesterone. Okay, and these combination pills are most commonly used. Okay, the most common example is Nilocon white, which you must be hearing. Okay, there are many other combination pills available. Okay, this is the brand name. Okay, Nilocon is the brand name. Okay, this contains the estrogen and progesterone. Okay, and it is very effective and easier to apply. Okay, it is taken orally, so it is very easier to apply. So and the success rate is also very high with 99 to 99.5%. Okay, so that is the advantage of this combination pills. Okay, effective, okay, easily used, okay, can be easily used, okay, and the success rate is also very high, and the recovery of the fertility rate is also very fast. Okay, so this mainly contains the low dose of estrogen and progesterone. Okay, and there are different regimen available for combination pills, that is monophasic pills, biphasic pills, and triphasic pills, depending upon their concentration available. Okay, so how these combination pills are given, okay, or taken. So this is very important. Okay, this combination pills, okay, it contains 21 combined pills, 21 plus 7 pills. Okay, 21 pills usually contains, okay, this is the usually drug available. Okay, so usually there is white tablets. Okay, there is 21 white tablets that usually contains estrogen and progesterone, and 7 tablets, okay, usually containing iron or lactose. Okay, so how it is taken? Okay, this usually it is taken on the 5th day of menstrual cycle. Okay, on the 5th day of menstrual cycle for the 21 consecutive days. Okay, without breaking this or stopping in between. Okay, she has to take continuously, okay, for 21 days, and then after that 21 days, okay, next 7 days she can take this iron tablet. Okay, so during these iron tablets, okay, there will be a menstrual cycle. Okay, so again after 5th day of menstrual cycle, then she has to take, okay, on the 5th day of menstrual cycle, again she has to start with another packet. Okay, she should not forget in between this okay, because if she forgets, okay, if she forgets 1 or 2 tablets in between, there will be irregular menstrual cycle. Okay, so if she forgets 1 tablet, she can take 2 tablets in the other in next day. Okay, but if she forgets 2 to 3 tablets, it's better to use the alternative method. Okay, alternative contraceptive methods apart from the using the hormonal contraceptives. Okay, like barrier methods. It's not going. Okay, so that was about the how to take the how the drug is taken. Okay, now what is monophasic pills? Okay, monophasic pills means there is no phasic increase or decrease in the progesterone or estrogen content during the 21 days of pill administration. Okay, for 21 days of this drug, okay, the drug of this estrogen and progesterone is not increase or decrease. Okay, it is same throughout these 21 days in cases of monophasic pills. Okay, so for example, okay, in monophasic pills, okay, there is a preparation of ethinyl estradiol and norgestrel. Okay, the dose is 30 microgram and 300 microgram progesterone, norgestrel. Okay, so throughout 21 days the dose will be same. Okay, of estrogen, and this ethinyl estradiol is the estrogen preparation and norgestrel is the progesterone preparation. Okay, so it is the same. Similarly, there are different preparations are available. Okay, with different dose. Okay, so these are the examples of monophasic pills. Okay, they contains the same dose throughout 21 days. So you can see other example of combination of ethinyl estradiol and levonorgestrel, ethinyl estradiol and norgestrel of different dose. Okay, ethinyl estradiol, desogestrel, mestranol, and norethindrone. Okay, so these are the different preparations of monophasic pills which contains the same dose throughout the day, throughout the 21 days. Now in biphasic pills, okay, so what happens in biphasic pills, that it has a fixed estrogen for the 21 days but increased dose of progesterone during the 2 successive phases. Okay, you'll understand by this. Okay, for the first usually the dose of the estrogen will remain same for 21 days. Okay, only the progesterone dose will increase. Okay, so what happens is the first 1 to 10 days, okay, there is one dose, and next 11 to 21 days there is slight change in the slight increase in the dose of the progesterone. Okay, so what happens with this is that it helps to mimic the hormonal changes during the menstrual cycle as physiological as possible. Okay, because if you see, okay, if you remember, as during normal physiological also, what happens, the at the end of the menstrual cycle, okay, what happens, there is a increase in progesterone, isn't it? So that type of physiological changes will be seen, okay, or will be as similar with this type of biphasic pills. So example, okay, combination of ethinylestradiol and norethindrone. Okay, so for first 1 to 10 days, okay, the dose of the norethindrone, that is the progesterone, is 0.5 mg, and for next 11 to 21 days the dose of the norethindrone is slightly increased by 1 milligram. Okay, whereas the dose of the estrogen, that is ethinylestradiol, remains same throughout the 21 days. So that is a biphasic cell. Only 2 changes is there. Okay. Now triphasic ma chai ke huncha ta? The name itself says 3 and tri bhaneko 3 palta. So there is a change in 3 dose of at 3 phases. Okay. So यसमा चाहिँ के हुन्छ भने ethinylestradiol ko चाहिँ in mid 7 to 11 days ma there is slightly change. Okay, so first ma 1 to 6 days ma चाहिँ 30 microgram छ भने 7 to 11 days ma there is 40 microgram, and then 12 to 21 days ma again the dose remains the same. Okay, and as for progesterone preparation, here there is a norgestrel is there. So norgestrel ko चाहिँ there is for 1 to 6 days 0.05 milligram, then 7 to 11 days again 0.075, and next 12 to 21 days 0.125 milligram. Okay, so there is a slight successive increase of progesterone preparation in 3 phases. Okay, so that is the triphasic. यसमा चाहिँ ethinylestradiol को पनि in between there is a change in the dose of the ethinylestradiol. Okay, now the advantage of this combination pills. One is, already we have said, it is highly effective, that is around 99 to 99.5%, that is almost 100% जस्तो नै भयो है, and it is very convenient to the patient. Okay, it can be easily taken, and also it is very cheap. Okay, and another advantage of combination of progesterone with estrogen is that, okay, progesterone, it decreases the risk of endometrial carcinoma. Okay, because if only estrogen is given, what happens, it can lead to endometrial carcinoma. So progesterone decreases this risk. So that was about the combination pills. Okay, we'll discuss the mechanism also. Okay, first let's discuss the different types of hormonal contraceptives. Now next is the mini pills. Okay, mini pills means it is also known as progestin only pills. Okay, so that means it only contains the progestin, it does not contain the estrogen. Okay, and this is given mainly in cases where there is a estrogen contraindicated. Okay, like in cases of thromboembolic disorder, hepatic failure, okay, endometriosis. Okay, so in those conditions, okay, estrogens are not given. So many pills, they are usually given soon after the delivery, or and it is continue without interruption. Okay, so many pills are given regular basis. Like in combination pills, there is 21 days of estrogen and progesterone preparation. Okay, that means this in combination preparations, okay, only for 21 days is given. There is a gap of 7 days. Okay, in between that gap, okay, once the menstrual cycle starts, then only on the 5th day again she has to take the new preparation. Okay, here in many pills the drug has to be taken continuously. Okay, the success rate is comparatively lower than the oral combination pills, that is 98.3%. Okay, example is norethindrone and norgestrel. Okay, norethindrone and norgestrel. Next is postcoital and morning after pills, which is again the important contraceptives, hormonal contraceptives. So it mainly contains the high dose of estrogen or high dose of progesterone. Okay, so it is also known as emergency pills. Okay, because it is usually given in for the emergency contraception. When given immediate, it is given immediately after the unprotected coitus. Okay, like for example rape or condom rupture. So example of postcoital pills are, okay, most commonly used levonorgestrel 1.5 milligram, okay, which is taken within 48 hours of unprotected coitus. Okay, so you must have seen or you must have heard in advertisement, okay, I pill or suneko hola hai, nowadays easily available. Okay, this is the pill that is used as a morning after pill. Okay, so this should be taken within 48 hours. Okay, because otherwise it won't be effective. Once the fertilization takes place, okay, or the implantation takes place, it does not work. Okay, so it has to be taken after within the 48 hours. Next of levonorgestrel 0.75 mg, okay, one tablet within 48 hours and second tablets after 12 hours of first tablet. That is the dose. The dose varies. Okay, levonorgestrel 1.5 milligrams, it can be taken once. Okay, whereas 0.75 mg ko चाहिँ within 48 hours ma एउटा tablet and after 12 hours of first dose ma चाहिँ अर्को tablet लिनुपर्छ. Okay, so there is another preparations that is called USP method. Okay, it contains estrogen and levonorgestrel. This has to be taken at 12 hours interval within 72 hours of unprotected coitus. Okay, next is mifepristone. Mifepristone is antiprogestin. Okay, it is also taken within 72 hours. Okay, and ulipristal. Okay, this is another drug that is it is actually the selective progesterone modulators. Okay, this is taken within 120 hours or 5 days of unprotected coitus. Okay, so these are called emergency pills. However, if this type of emergency pills fails, okay, to prevent from pregnancy and the pregnancy occur, then medical termination of pregnancy is advised to avoid the teratogenic effect to the fetus. Okay. Now next is the injectable contraceptives. Okay, sangini sui jun bhaन्छौं हैन, that is the again injectable hormonal contraceptives, which is given by injection. Okay, and it mainly contains the long acting progesterone derivatives. Okay, so this is a depot medroxyprogesterone acetate. Okay, it mainly contains the depot medroxyprogesterone acetate, which is also known as depot provera also. So this is given by intramuscular route. Okay, the 150 milligram of medroxyprogesterone is given every 3rd month. Okay, starting just after the menstruation or during the first 5 days of menstrual cycle. Okay, so this injection is given, okay, either immediately after the birth or, okay, 5 days of menstrual cycle. Okay, so and after that, in between 3 months, okay, every third month again this injection is given. Okay, it is useful in patients having heavy menstrual bleeding and for those whom estrogen is contraindicated. So this mainly contains the high dose of progesterone, okay, which is given for every 3 months, okay, and it is mainly given to prevent in patients who are having heavy menstrual bleeding and to the patients who is contraindicated to the estrogen. Okay, the return of the fertility here, it will take 6 to 30 months after discontinuation. That means the return of fertility is very late than the oral combination pills. If you compare with the oral combination pills, okay, the return of fertility is late. Okay, whereas for return of fertility for the oral combination pills is very fast, immediately after stopping the drug. Okay, so this is about the injectable contraceptives. Now next method is the Norplant, okay, or subcutaneous implant. Okay, so this Norplant, again, it contains the levonorgestrel, which is the progestin. Okay, and in this preparation, okay, it mainly contains the 6 capsules. Okay, 1 2 3 6 4 5 6. Each capsules, it contains the 36 milligram of 36 gram of levonorgestrel. Okay, this all 6 capsules contains the 36 milligram of levonorgestrel. Okay, so total, that means it contains 216 milligram of levonorgestrel. So this capsules is implanted in the subcutaneous tissue. Okay, like for example in the upper arm. Okay, so and then from these capsules the drugs are slowly released and it is effective for 5 years. So you can see, okay, if the patient wants the gap between two child, okay, for 2 to 3 years or for 5 years, then she can use this type of contraceptives. Okay, and if the patients wants only for 1-2 years, they can go for the injectable, okay, or only for a few months, okay, then they can go for the oral combination pills. So here the contraceptive effects is readily reversible with the removal of the implants. Intrauterine inserts. Okay, so this is like copper T only, if you have seen the pictures. Okay, but this does not copper T contains the copper, okay, but this contains the hormone, that is the levonorgestrel, which is again a progestin preparation. Okay, so this is again a newer intrauterine contraceptive device which contains levonorgestrel, and this at the rate of 20 microgram per day it is released in the uterine cavity. Okay, and the efficacy of this type of device is also for 5 years. So the action of this type of preparation, okay, which acts directly into the uterus, will have action only locally in the uterus. So the advantage is that it will have a less systemic effect. Okay, and the fertility also have been found to be immediately returned, okay, after the removal of the insert. Okay, so I hope till now you have understood the different methods of contraceptives. At least, yes or no? Okay, Reshma, बुझिरहेछ types of contraceptives?
Yes, ma'am.
Okay. So now more important is the mechanism, okay, how they prevent the pregnancy. So now let's go with the mechanism of action of hormonal contraceptives, okay. So as I have said, hormone contraceptives, they contains estrogen and progesterone, okay. Some contains estrogen and progesterone and some contains only progesterone also, okay. So the mechanism of action, okay, which contains both estrogen and progesterone, okay, they both inhibit the ovulation, okay. So they will have the synergistic action, okay, to inhibit the ovulation by inhibiting the release of FSH and LH. That FSH is the follicle stimulating hormone and LH is the luteinizing hormone, okay. And also progesterone inhibit the estrogen induced mid-cycle luteinizing hormone surge, okay. So if you remember, okay, estrogen it also helps to sudden increase of the luteinizing hormone in the mid-cycle of ovulation, which helps to release the ova, okay. So progesterone inhibit this process also. So you can see in this picture, okay, usually normally what happens, there is a, for the regulation of the female sex hormones, okay, there is a existence of this axis, that is the hypothalamus, pituitary and ovary axis, okay. So what happens usually, this gonadotropin hormones, okay, it produces the anterior lobe cells to secrete the FSH and LH, okay, luteinizing hormone and follicle stimulating hormone from the pituitary gland, okay. And then in the ovary, this follicle stimulating hormone, it promotes the growth of the follicles, okay, and maturation of the oocytes. Then luteinizing hormone also will help to release the ova, okay. And along with that, there is a release of estrogen, okay, which helps to priming of the endometrium, okay, and other reproductive events, okay. Then as the estrogen rises, okay, what happens as the estrogen rises, okay, there is a luteinizing hormone source which will cause the ovulation, okay. So the rise in the estrogen and progesterone will again inhibit the FSH and LH secretion from the pituitary gland, okay. So that is the negative feedback mechanism in the for the secretion of female sex hormones, okay. So I hope everyone remember this cycle, right? In the mid-cycle, this luteinizing hormones causes the ovulation, and the once the ova is released, there is a formation of corpus luteum, and from the corpus luteum, progesterone is secreted, okay. And both estrogen and progesterone inhibit the further secretion of FSH and LH, okay. So both estrogen and preparation, when given exogenously, what happens? They inhibit the secretion of or release of FSH and LH, okay, and that will inhibit the ovulation, okay. And also progesterone inhibit the estrogen induced mid-cycle LH surge. So you can see, okay, in the uterus also, the combination form will disrupt the proliferative and secretory phase of the endometrium, okay, which will inhibit the chances of nidation of ovum. That is, the implantation of the ovum is also inhibited, okay. So proliferative and secretory phase of the menstrual cycle, if you remember, okay, estrogen and progesterone, they helps in proliferative and secretory phase that is required for the fertilized ovum to be implanted, okay, to continue the pregnancy. So this proliferative and secretory phase is also disrupted, okay, in the endometrium. So there is another mechanism. So one important mechanism is that it inhibits the ovulation by synergistic action of estrogen and progesterone to inhibit the release of FSH and LH and inhibiting the LH surge. Okay. Next mechanism is by inhibiting the implantation. Okay, by disrupting the proliferative and secretory phase of endometrium. Okay, and next is the also progesterone. It increases the viscosity of cervical mucus, rendering the endometrial hostile for the sperm penetration. Okay, so it increases the viscosity of progesterone. It increases the viscosity of the cervical mucus also. Okay, did you get the mechanism of action of combination pills? Okay, where progesterone is only prepared, is only available, progesterone only available भएको ठाउँमा चाहिँ progesterone ले पनि inhibit ovulation गर्ने भयो, implantation पनि inhibit गर्ने भयो because of disruption of the secretory and proliferative phase, and also progesterone, it increases the viscosity of the cervical mucus. Okay, these are the main three mechanisms of hormonal contraceptives. Now next important is the adverse effects. Okay, adverse effects ma चाहिँ के छ त, one is it can be further divided into mild, moderate and severe. Okay, mild, moderate ma no need to withdraw the oral combined pills. Okay, moderate ma we have to watch, and in severe conditions ma we have to stop the drug. Okay, so nausea, headache, breast tenderness, okay, mild edema, breakthrough bleeding, which mainly occurs in progesterone preparations only. Okay, spotting or amenorrhea, these all are mainly adverse effects of progesterone preparations. Okay, and increase in body temperature. In this type of adverse effects, okay, we do not need to withdraw the hormonal contraceptive. Next is in cases of moderate ma चाहिँ other adverse effects are weight gain, okay, acne, hirsutism, vertigo. Okay, it can precipitate the diabetes. So we need to monitor the, if the patient is diabetes mellitus, we have to monitor the patient. Okay, blood glucose level, and then mononaleal vaginitis and chloisma. And in severe adverse effects, it can lead to thromboembolism. Okay, cholestatic jaundice, then polylithiasis, hepatic adenoma, myocardial infarction and cerebrothromboembolism. Okay, so it's not that the drug contains the hormones estrogen and progesterone. Okay, so this estrogen and progesterone preparation, okay, it can lead, sometimes it can also lead to severe adverse effects. So we have to monitor the patients while patient is on these hormonal contraceptives. Okay, now next is the contraindications. So there is again absolute contraindication and relative contraindication. Okay, in absolute contraindication means, okay, we cannot give the drug to this type of patients, whereas relative ma चाहिँ we can give by close monitoring of the patient. Okay, so one contraindication in cases of pregnancy, okay, because it can lead to congenital limb formation, genital carcinoma in female, okay, muscularization of the female offspring and precipitation in male offspring can occur. Okay, so it is also contraindicated who is already known to have thromboembolic disorder, hepatic, renal or gallbladder disorder, okay, breast carcinoma, in cases of moderate to severe hypertension, and also in cases of porphyria. Okay, so these are the absolute contraindication for the hormonal contraceptives. And as for relative contraindication, in case of diabetes, okay, we can go with the increase in dose of the oral hypoglycemic drugs, okay, obesity in mild hypertension, smoking, okay, we can tell the patient to stop the smoking, epilepsy, okay, this oral combined pills or oral hormonal contraceptives, okay, it has found to decrease the seizure threshold also. So the anti-epileptics, the efficacy of anti-epileptics drugs is reduced, okay. So we have to monitor the, or we have to increase the dose of the anti-epileptics drug also. So it is also contraindicated in undiagnosed vaginal bleeding and in cases of migraine. Okay. So now next important is the drug interaction. Okay. So drugs like rifampicin, phenytoin, carbamazepine, these are the enzyme inducers. Okay. That means they increases the enzymes. Okay. Hepatic enzymes. So that will increase the metabolism of the oral contraceptive pills, so that will decrease the efficacy of the drug. Okay, rifampicin, antitubercular drugs, phenytoin, carbamazepine, these are the anti-epileptic drugs. These are the enzyme inducers, so they increase the metabolism of these hormonal contraceptives and decrease the efficacy. So in this patient who are taking rifampicin, phenytoin or carbamazepine, it's better to go with the alternative methods than to the hormonal contraceptives. Next interaction, okay, insulin and hypoglycemic drugs, okay, has to be increased again in presence of oral combination pills. And antimicrobial drugs, it has been found to decrease the efficacy of the oral contraceptive pills, and it's because of the killing of the flora in the intestine, okay, that retards the enterohepatic circulation of the estrogen, okay. So that is about the drug interaction. Okay, now next is the non-contraceptive health benefits. Okay, so non-hormonal, apart from this contraceptive, okay, this mainly the combined pills that contains estrogen and progestin, okay, these drugs, apart from using as a contraceptives, okay, they also have a non-contraceptive benefits, okay. So what are the non-contraceptive health benefits? It has found this combination pills, okay, it reduces the risk of functional ovarian cyst or ovarian cancer formation, okay, fibrocystic breast disease, okay, bleeding uterine fibroids and endometrial carcinoma, okay. So this combination pills has the advantage to decrease this other disease condition, okay. And another advantage of this combination pills, mainly in those who have the imbalance of the menstrual cycle, or there is a heavy bleeding, okay, dysmenorrhea, or there is a premenstrual tension, okay, it has found this combined pills to decrease these symptoms, okay. So the menstrual cycle also becomes regular, okay. Then also it helps to decrease the blood loss, that is the menorrhagia, decrease the premenstrual tension, and also decrease the dysmenorrhea, painful in the menstrual cycle, as it prevents the pregnancy. So there is a low incidence of ectopic pregnancy also, okay. The endometriosis and pelvic inflammatory disease are also improved, okay. And then also with combined pills, as the preparation contains the iron tablets, the iron deficiency anemia is also decreased, and also due to the reduced blood loss, the iron deficiency in women is also decreased, okay. So these are the non-contraceptive health benefits, okay, other advantage of combined pills that you should remember, okay, because combined pills is very important for the syllabus point of view also, okay. And these questions are also commonly asked in exam as well as in the viva also. So this was about the hormonal contraceptives, okay. Now there are other contraceptive, that is the Centchroman, which is a non-steroidal estrogen antagonist. Okay, this is given twice a week for the first 3 months and then once a week subsequently, to be continued irrespective of the menstrual cycle as long as the contraception is required. Okay, so Centchroman, it is an estrogen antagonist which is given twice a week for the first 3 months and then once a week, okay, till the patient wants the contraception. And the reversible of the fertility is also within 6 months of stoppage. Mechanism is that the Centchroman, it is a potent competitive antagonist at the peripheral estrogen receptors. Okay, so it blocks the estrogen receptors and also it suppresses the proliferative stage of the endometrium. Okay, so that is the mechanism of Centchroman, and also it has been found to desynchronizing the event of the ovum transport within the endometrial phases of development. Okay, so the ovum, because the Centchroman, it inhibits the ovum transport into the endometrium also. Okay, so advantage of this Centchroman is that, like hormonal contraceptives, they causes vertigo, weight gains, hypertension, breakthrough bleeding. Okay, this type of adverse effects is not seen with the Centchroman. There is no thrombotic episodes. Okay, no risk of cancer, no changes in the lipid profile. Okay, it does not exhibit the anti-androgenic and progesterone properties like some progestin preparations. It also has anti-androgen action. Okay, and it does not affect the pituitary, thyroid or adrenal hormones secretion, and there is no teratogenic effect is also seen once if there is a continuation of the pregnancy. Okay, so like estrogen and progesterone, they have got the teratogenic effect, but with Centchroman, the teratogenic effect has not been seen even though the pregnancy has occurred. So side effects of Centchroman is the nausea, okay, edema, weight gain, rise in some patients, okay, rise in blood pressure and prolong the menstrual cycle. So that is about the Centchroman. And next is the Gossipol, which is the male hormonal contraceptives. Again, it is a non-steroidal hormone, okay, which is given orally, and it is obtained from the some type of cotton seed. Mainly, it was first discovered by the China. Okay, and the mechanism is that it decreases the sperm count and decreases the sperm motility within 3 months. Within the 3 months, okay. So for initial 2 to 3 months, 20 mg is given. Then, as for maintenance dose, 50 to 60 mg per week is given. Okay, and it should not exceed for more than 2 years because again it can lead to infertility. So Gossipol, side effects of Gossipol is the hypokalemia, okay, which causes muscle weakness and transient paralysis. It can lead to diarrhea and breathlessness. Okay, and for long term it can lead to infertility. So usually male hormone contraceptives are less commonly used. So I think that was for